Hello, welcome to our Mental Health and Wellness Expo. My name is Dr. Jaime Kurtz. I am the Senior Vice President of Education and Employment Development. This conference is hosted by DHR Health and our Region 1 Service Center here at Edinburgh, Texas. You're going to hear a lot of topics, primarily yoga, exercise, diet. But the most important thing that I want you to kind of concentrate is on how can you improve your mental health and your overall wellness. I'm pretty sure that all of us have gone through a very difficult year and we've stayed at home and we haven't done too much exercise. We haven't been really eating too well, but it's now time to reflect. So I encourage you to sit back, listen, and take notes as you will be hearing some experts on these topics. Thank you.
The Rio Grande Valley, Texas, 1990 population, 450,000. In 2018, it was over 1.4 million and rapidly growing. For decades, South Texas lacked critical access to healthcare services. With the dynamic growth of the region, there was a mounting need for better healthcare. In 2003, local physicians came together to create a full-service general acute care hospital to meet that need. DHR Health, rising for you for life.
Carlos Cardenas, Chairman of the Board, Chief Administrative Officer. We are an acute care hospital that is open 24/7, 365 days of the year. We built this hospital so that we could be the very best physicians we could be. We were able to remove the impediments that got in our way that kept us from doing the things that we knew how to do. DHR is managed by the same physicians who deliver the care at the bedside in our hospital. We put the patient at the center of everything that we do.
It makes me a better physician to be able to work in a facility where every member of the healthcare team feels empowered to make the very best decisions for their patients. It's done that way here every single day, every time.
My name is Robert Martinez. I'm the Chief Medical Officer and Chief Physician Executive. So in the beginning, when we were working, most of us were out-of-town corporations, what we found was we were really having problems getting the things, the resources we needed to best care for our patients in the hospital.
Patients were denied the sophisticated services that were available elsewhere. Physicians were denied the means to treat the patients in the manner in which that they were trained to do so.
A particular instance I remember is when I had a really sick patient with abdominal pain, severe abdominal pain. I needed a CAT scan, I needed it quick, and I think there was a refusal of the administration at this particular hospital to hire the appropriate staff and have the appropriate equipment to be able to get that test done. That made me realize there was a problem.
At the same time that tens of millions of healthcare dollars were being taken from the community and shipped to out-of-state corporations.
So when you see an example like this, you really have to ask yourself, who really is benefiting from this healthcare? It sure wasn't the patient, and it sure wasn't the physician.
When I was growing up, we had to travel outside of our area in order to be able to get similar care to what we can provide here today. We had to travel to Houston, 350 miles away. We had to travel to San Antonio, 240 miles away.
The Valley has always been so isolated, both in terms of healthcare and economics.
I'm Dr. BERTHA Medina, and I practice obstetrics at DHR Health Women's Hospital. We live in one of the poorest counties in the United States, and I think a lot of our patients don't have access to health care, perhaps until very late in their lives.
We decided to leave the old paradigm and create a new way to deliver healthcare, putting patients at the center of what we do, where the same physicians that care for our patients are the ones who manage our hospital and make the choices and decisions that deliver the highest quality care to the patients in our community.
DHR Health represents a unique model of medicine where physician leadership, the latest medical technology, and a keen understanding of the community are paramount for delivering world-class health care for South Texas. DHR is majority owned by the same doctors who treat patients every day. It's not a new idea. Historically, doctors would own hospitals. But over the years, corporate healthcare took greater control of hospitals, and the gap widened between doctors and their patients. More layers of administration bureaucracy were getting in the way of patient care.
Who better than physicians to be making choices and decisions about what equipment we should have, what nursing staff ratios should be, how a facility should be managed?
As doctors, we're at the bedside of our patients. We know firsthand what they're experiencing. If we have any difficulties with their care, we can take the problem to the boardroom and immediately resolve their issues for the betterment of their care.
Many hospitals, I think, in our country are run by out-of-state corporations. They answer to Wall Street. We are a community-based hospital that answers to Main Street.
It's all about the patient and the community you serve. If you're true to the community will be true to you.
Here in South Texas, we are the trendsetters. We are the trailblazers. DHR Health is a hospital that is being innovative in the delivery of healthcare.
Physicians want to help people. They dedicate their lives to alleviating suffering and pain. A physician-owned hospital? Well, that's a label. This is a hospital that is built for the community. This is a community hospital. DHR Health, rising for you for life.